Hi, everyone. My name is Keto Adelsheim, they, them. I am joined here by Lucia Kalinowski, and we are going to be presenting about navigating MNsure for trans, non-binary, and gender non-conforming individuals. This presentation was made by Lucia, myself, and Jay Miles. Jay is part of the presentation. He just is not presenting with us, so he is a good resource to reach out to as well. What we're going to discuss today is what MNsure, what our team can offer to consumers. So what the JustUs Health MNsure team can offer to consumers, what MNsure is and which health programs are available through MNsure, how gender identity interacts with the MNsure system, and how gender affirming care is covered under various Minnesota healthcare programs. Just so you know, we're not going to read everything on all of the slides, but we can send these slides to whoever would like them. And you can also reach out to us with questions at benefits@justushealth.org, or you can give us a call. All right, so let's get started. If you don't know about JustUs Health, we were formerly the Minnesota AIDS Project, and our mission is to work for equitable healthcare access and outcomes for people who experience injustice at the intersection of health status and identity. We center individuals and communities at risk of and living with HIV or facing barriers to equitable healthcare access and outcomes because of their identity as gender, sexual, and/or racial minorities. So our MNsure team is currently comprised of 3 MNsure navigators. There's Lucia, Jay, and myself. There are a few reasons why you might want to seek help from JustUs Health MNsure navigators in particular. So we offer gender-inclusive MNsure navigation. We can offer assistance applying for MNsure, applying through MNsure, and troubleshooting issues either with the MNsure application process or with your actual coverage. We do offer expertise navigating gender affirming care through MNsure. We have a lot of experience with that. We can offer referrals to legal help if you're denied by your insurance for gender affirming care. We have a legal team that works at JustUs Health that has a lot of experience with this. We can also refer individuals to partner organizations if people are having issues with something that we are not experts in. And if you're not sure exactly where to start with all of this, we can just be a resource for you. So you can give us a call and we can just talk through the process. So we're just going to start by talking a little bit about what MNsure even is. So MNsure is it's Minnesota's marketplace where you apply for insurance. It's not a health insurance plan. MNsure offers eligibility determinations for 3 separate programs. So there's medical assistance, that's same as Medicaid, Minnesota Care, and private plans, which are called qualified health plans. And eligibility is determined based on income, household size, immigration status, and disability status. We do just want to stress that MNsure is not a health insurance plan. This is important just because if you are trying to figure out your options for top surgery, say, and you say, I have MNsure for insurance, you'll probably need more information than that because there are multiple options that could be your insurance if you just say that you have MNsure. So it's important to know the difference between the types. And there is some useful language to know before moving on. I'll just kind of explain what this graphic is here. So when an insurance year starts, say it starts January 1st, the first thing that usually happens is the consumer pays 100% of cost until the consumer reaches their deductible. So that's, that's everything from the start to the deductible you would pay. And then after that, you move into the coinsurance phase. So the consumer pays whatever percentage of coinsurance that the plan has agreed upon, and then the insurance carrier would pay the remainder. And then once you reach what's called a maximum out of pocket, then the carrier would pay 100%. So these are just important terms in terms of what we are going to be talking about now. So MNsure offers medical assistance, Minnesota Care, and qualified health plans. These are, usually for people who don't have coverage through their employer. That's not always true. Sometimes people are still eligible for medical assistance even if you have employer coverage. So that's something that is an option based on income. So medical assistance is the same as Medicaid. You don't have any premiums or deductibles under this, and consumer cost is very low usually. It's managed through the county that you live in, and you can enroll year-round. Also, something to note is that MA can backdate up to 3 months, and that just makes it a little easier. If you know when your insurance is going to end, you don't necessarily have to rush to apply. We do usually recommend that you just apply as soon as possible, but it's not quite as time sensitive as the other programs. The next program is Minnesota Care. That's meant to cover people who aren't eligible for medical assistance, but still have low enough income that they would qualify. So you do have a small premium that you pay every month. There aren't usually any deductibles, and co-pays are a little bit higher than medical assistance, but they're still very low. So still very low cost. This is managed by the state of Minnesota. You can also enroll year-round for this. You cannot have any other insurance to be eligible, so you would have to be uninsured in order to be eligible for Minnesota Care, and this cannot backdate. So if you know that your insurance is going to end, you will want to apply the month before that your insurance ends, just so you don't have a lapse in coverage. And then the next step up is what's called a qualified health plan. So these are private plans that you would sign up for through MNsure after you complete the application. There are usually premiums associated with the qualified health plans, and these premiums depend on your age, household size, income, zip code, and whether you use tobacco. There are deductibles and maximum out-of-pockets. So they're a little different than medical assistance and Minnesota Care. And you may qualify for assistance with premiums, and that is something that you would find out when you do the MNsure application. And you can enroll during open enrollment or a special enrollment period, and this also cannot backdate, so you'll want to apply as soon as possible. Now, this slide is just showing the income limits for each of these programs. So medical assistance is usually based on monthly income. And for one person, so for a household of one, the income limit monthly is usually around $1,400. And then if you move to Minnesota Care, it's annual income that it is based off of. So then it would be around $25,000 that you would be able to make until you were no longer eligible for Minnesota Care. And then you are eligible for tax credits to go towards your premiums for the qualified health programs up to around $51,000. All right, so now I'm going to hand it over to Lucia.
Cool, thank you. I'm Lucia. I use they, them pronouns, and I'm going to be talking a little bit about like what to expect from the application process, and especially kind of like some common concerns that we get from trans clients that we're working with. So if you are going to be doing the application with us or on your own, some things that you'll be able to, that you'll need to be able to answer are whether you're a U.S. citizen, what your immigration status is. That is a harder question than a lot of people realize. You will probably need your alien number if you're not a U.S. citizen. You'll need to know the social security numbers for yourself and anyone else on the application. You'll need to know if you're filing taxes on your own, if you're not filing taxes, or if someone else will be claiming you on their taxes. You'll need to know if you have other health insurance through a parent or a spouse or someone else. And we'll need a little bit of information about that employer. You'll need to know if you're certified disabled. Again, that can be a trickier question than some people realize. And then it's helpful if folks have a photo ID for the application process. We don't always need it, and if you don't have one, there are ways to get around it. They just take longer than the options that you have if you have a photo ID. So yeah, those are some ways to prepare. Okay, so in terms of name and gender, obviously we'll call you by whatever name you go by and whatever pronouns you use. MNsure does require a legal name and gender on, it's a little tricky, right? Because MNsure has two gender options. The Minnesota driver's license has 3 gender options now. So they typically tell us to go by Social Security gender. However, there are some times that we're going to we've talked with MNsure a lot about how to handle this. For people who are pregnant, regardless of their gender and their legally recorded gender, they probably want to put down female in order to miss any hiccups with care that they need with accessing pregnancy care. And we can help you figure out what is the right gender to put down on the application, and recognizing that that's a question not of who you are as a person, but of how it's going to affect your health insurance based on what you put down. So we'll approach that strategically, but then, you know, our records will reflect your actual name and gender. So if you change your name or you have a legal gender change or any other change, we can help you report that. Those can be a little bit, sometimes the people that we report them to don't really understand. So we can be a little bit of a buffer and say, you know, this is the person's legal name, this is what we'll be calling them, things like that. But we would report, if there was a change and you had a qualified health plan, we would report it to MNsure, and then we double check to make sure that it went to your provider. So UCare, Health Partners, Medica, we could help you make sure that you get a new card. Minnesota Care, you report it to Minnesota Care, and they also manage the plan, so it's a little easier. And the same thing, medical assistance, the county of residence is where you report, and it's who manages the insurance. So that's a little simpler, but we're happy to help report any changes. Oh, this slide got fancy. Okay, so a big question that we get, of course, is what gender affirming care does MNsure plans cover? That is a trickier question than we wish it was. The big caveat is that the policies on what is covered and what is not is being set by precedent of appeals, not by the law. So if you looked up Minnesota state law on what gender affirming care is supposed to be covered, it is totally wrong compared to what is actually covered. So because a lot of the appeals are being managed by the lawyer at JustUs Health, but there are others, of course. We have a pretty good idea of what has been appealed when people have been denied, and how those appeals have, what's been overturned. So precedent is always changing. We can talk you through how much precedent there is for something being approved, and what to expect in terms of what might be covered. So that's the big caveat. It's always changing. If the law doesn't reflect the reality. And with that caveat, this is kind of what we know. This slide also got fancy. Okay. So for gender affirming care, public programs, MA and Minnesota Care, hormones are covered pretty routinely, that most people don't get denied and have to appeal. Top surgery and bottom surgery, again, also for trans men and trans women, and non-binary people, covered very routinely. Facial feminization surgery and facial hair removal, there is some precedent. My understanding is that there is at least one person who has gotten facial feminization surgery covered by a public program. But if you wanted facial feminization surgery, you would probably be denied, and then you would have to appeal, but we would expect that the appeal would be successful. The same thing with facial hair removal. There are some cases, my understanding is that there are some cases in progress of people who have been denied and are appealing, and we expect those to be successful. The bar, like the data that Minnesota uses to determine what is medically necessary and what is not, is set by WPATH, which is a professional organization for transgender health. And they do the research on when a trans person gets this medical intervention, how does that affect their overall well-being? And they make recommendations on what is considered medically necessary based on the research that they do. So that's the guidance that Minnesota is supposed to be following, but right now they still have to be pushed to get there. There are things that WPATH considers medically necessary that are still routinely denied. So we are in the process with our legal team of pushing that boundary and getting Minnesota into line with what it says it does. Yeah, for private plans, so a qualified health plan, hormones, top surgery, and bottom surgery are routinely covered. Facial feminization surgery and facial hair removal, we don't know as much about how many people have been denied, if they've appealed, things like that. Again, the WPATH standards say that that's medically necessary care. Employer coverage. So this is our least expertise area in terms of types of insurance. We don't work with employer coverage very often. Oh, my slide just disappeared some things on me. Okay. So the employer coverage, it depends on if the healthcare is self-funded or not, which is just kind of the financial structure of how the employer runs the insurance. Most employers must cover insurance for the employee seeking gender affirming care. Most employers don't have to cover gender affirming care for the spouse or dependents of the person who's employed. So if you're on someone else's health insurance through their employer, you might be in a hard spot. You can talk to us if you're in a position like that, or if you're trying to figure out what might be covered. We would refer you to our legal team. Yeah, so that's kind of how we would handle that situation. So prior authorization, most of the services that we talked about, top and bottom surgery, too far, to require a referral, prior authorization, and continuous care from a mental health professional and ongoing hormone therapy. The prior authorization process is listed in the member manuals for the different plans. We're not experts in the prior authorization process. Mostly we would say, here's the link to the member manual. You can check it out and do it that way. We do have another organization that does some of more like walking people through that process that we could refer you to. And then medically necessary criteria. So gender confirming surgery is considered by the state of Minnesota. Obviously, what we believe is medically necessary and what the state of Minnesota believes is medically necessary is a little different. But what they consider it medically necessary if you've been diagnosed with gender dysphoria and you meet these other criteria. So you need letters from 2 physicians. And then the language that they use is gender role must be congruent with gender identity for at least 12 months. I don't know how they verify that. That's what it says. And again, these definitions of what's medically necessary are constantly changing as issues make their way through the court. But we could help you kind of set expectations. Yeah, and then so Minnesota is supposed to follow WPATH's guidelines, but we're still pushing them to actually get there. So how can we help? We can help you apply. That's really our area of expertise is the application process. We can help you choose a plan where your doctor and surgeons or therapists or whoever are in network. And we can help you understand what is covered, what is ambiguous, to help you set expectations for what care you may be able to get and what it would take to get there, if you would have to probably be denied and appealed, or if you would probably be approved for that care. We can refer you to our lawyer, Phil, if you are denied and you want to appeal, he can help you. And we can refer you to other organizations that help resolve coding and billing issues. So the best way to get in touch with us is benefits@justushealth.org. Send us an email there. And a lot of these things are really sort of like one-on-one questions of, it depends a lot on what exact program you qualify for. It depends a lot on, if you have a diagnosis, things like that. But we can work with the specific questions of your specific case and just help you set expectations. Yeah, that's what we offer. Gatel, do you have anything to add, or we covered everything?
I think that's it for me. Yeah.
Great.
Just reach out if you have any questions for us.
Yeah, for sure. Definitely send us an email if you have questions about the presentation in general, or if you have questions about how this applies to you specifically. Thanks so much for watching, and we hope to hear from you.